now. Uh,
Yeah, we are live,
Hi,
yes.
everybody.
Hi.
Hi. Good morning, Dr. Sujatha.
Good morning,
So,
Vandana.
good morning, viewers. This is Vandana Hiranandani from Anatta Humanversity, and today it's been an utter joy and pleasure to introduce my own person of my team, Dr. Sujatha Nair, who is our keen counselor and a very good doctor where detoxification is concerned. And she has this great ability of catching the right issue which our clients have concerning their digestive system or any activity in their emotional state of mind. And she is able to give us a great review of each and every client. And we follow that advice and go ahead where the people who have issues with alcohol and drugs come to us. We have also opened the doors for people who are suffering mild depression and anxiety. And our centers now are in Pune and Dehradun. Yes, we moved to Dehradun currently due to corona events that are happening in India, and Dehradun appears to be a safe haven for people coming for the treatment program. Right, Dr. Sujata?
Yes, Vandana, very true. We are exploring
So,
different areas.
yes. And as we would like people to know further in our conversation, how we have emphasized on the single client facility, and that's going great guns in Dehradun. So we'll come to that.
Yes.
And Dr. Sujata, everybody knows the great things that you've done, your achievements, as well as your educational abilities. So that I will leave it for people to look up for you in the website. So
Yes.
www.anatta.in or anattarecovery.com. Sujata is all over the Anatta Humanversity social media. So you can catch up with her or the information which is provided on that. Dr. Sujata, what would you begin with? What would you like to share then before I ask you the questions that we've decided to do it?
Yeah, Vandana. I would only like to share that Anatta has been our baby. Let's put it like that. And along with Anatta, we have grown as individuals and as professionals. And we have from the year 2004, let's put it like that. And we have reached a stage wherein we are at our best and we can provide the best for all our clients who come to us. So let's begin.
Yeah, nice. So, as you said, let's begin. I will say, Dr. Sujata, we all have heard, and people around in for the laymen also, they say once an alcoholic, always an alcoholic. What are your views about this? What would you like to tell the
Yes.
audience?
Yes, the thing is that once an alcoholic, always an alcoholic is a term that we often hear. However, for a person who is not involved in the field, it is a difficult thing to understand and to accept. Now, someone who is a social drinker, for example, someone who can manage to drink, say, two drinks or go every day and is able to limit oneself to those two drinks, is what we would call an apparent social drinker. However, for someone who is addicted to alcohol, where that line has crossed long ago, wherein it is the alcohol that is controlling the individual and not the other way around, in that situation what happens is that the individual can never go back to social drinking. Now, to
Mm-hmm.
understand it from a medical point of view, I would like to get into something called as neuroplasticity. That, putting it very simply, it's like any habit, anything that we learn in life. Say for example, driving. We learn, say it takes around 21 days for any activity to get embedded in our brain, for any new habit to take set itself. Now, once we have
Mm-hmm.
learned how to drive, even if we have not driven, say, for a decade, and we find ourselves behind the steering wheel of a car, our body will automatically know how to drive. So,
Mm-hmm.
like, why does that happen? It happens because there is a pathway created in our brain for driving. In the same way, for someone who is drinking to addictive levels of consumption of alcohol, there is a pathway created in the brain for that kind of consumption of alcohol. So, suppose a person has managed to stop drinking, either on his or her own merit or through a treatment program, which would have been ideal. And if the person unfortunately picks up a drink, say after 10 years or even 12 years, even 20 years, that pathway in the brain which was used to that kind of consumption which that person was used to, say 10 years ago or 20 years ago, gets reactivated. And very soon enough, the person starts consuming the alcohol in quantities which the person used to consume, and also will reach a level where the person would have reached if that individual had continued to drink for 10 years or 20 years of his or her life. And the physical damage that happens only gets accelerated. Hence, it is very clear that someone who has become an alcoholic because of the consumption and duration of consumption of the alcohol, the damage created is so much that if the person goes back to drinking, will reach that level eventually. Whether the person begins with, and I've seen this with a lot of people over the years whom I've been in this field since the year 2005. So people who have relapsed or slipped always came back with a history that I started with just one beer again, for example. It's just
Yeah.
one beer, but that one beer, then one does not get that high. One beer becomes a crate of a beer. Then that one crate of beer becomes bottles of wine. Then from bottles of wine, it goes on to back to the person's drink of choice, which can be whiskey, vodka, whatever. So the eventual consumption will be as earlier and worse. Hence, the term that once an alcoholic, always an alcoholic is very true.
So as soon as the receptors are activated, it is just a matter of time whether a person starts with one beer, wine, or whatever they consider as simpler alcoholic beverages. They will reach to their choice of
Yes,
beverage, alcoholic beverage, and then can go beyond.
yes.
And what I have also understood, a slip or a relapse, whenever they come across or they face that event of a slip or relapse, is always worse than the previous one.
Yes, definitely, without a doubt. That has been our experience too.
Yes. So, viewers, I would also like to put across this that Anatta setup, the whole system of a rehabilitation that we are running is based on experiential counseling. And we have a team, a medical team, which is Dr. Sujatha Nair, Dr. Rajiv J. Rajani, and Dr. Shashi Menon, who guide us to lead this program and make it a whole 360-degree holistic program for the betterment of the people that visit us. So here is my question to you. What would you like the viewers, how would you explain a week of our rehab center, which is the Anatta Luxury Rehab Center?
So, Vandana, our rehab center, which is a luxury rehab center, our unique point is that we only take people, individuals who would like to enter the program voluntarily, in the sense that they would like to bring about a change in their lives. They want to stop drinking or using substances, but they do not know how to, and they're ready to seek the help required. Now, that is one very important thing, which is we are completely voluntary. Another thing is that we are non-medical, in the sense medicines are used only for detoxification, the detoxification process, which is wherein the person has to stop the substance before he or she comes to us and will face some amount of discomfort, for which certain medications are given for a very few days, which are tapered off. This is done under the supervision of our team psychiatrist and MD Med in a clinical environment, following which the individual is taken to a place of residence. After that, we now currently treat single clients and also one, two, or three clients. But the USP of ours, or what I would say our niche process, is that we provide one-on-one counseling to every individual who comes to us. Every client who comes to us has at least three counselors who are experiential and a physician living with the individual 24/7. And why is this important? Because a person who is suffering from addiction goes through a lot of emotional issues and a lot of emotional swings, which can surface not necessarily in a regular working environment of 9 a.m. to 5 p.m. It can happen anytime during a 24-hour period. Us being available for that individual in that 24-hour period is very, very crucial, so that that individual's issues can be resolved when they surface.
Hmm.
So I would say, and we follow a lot of alternate life therapies like counseling, meditations, and other therapies in order to treat a person holistically. We are not here to treat the alcohol or the substance of choice, but we are here to treat the individual who is ill, who is sick with the disease of addiction. So, hence, the treatment is focused on the individual, and not only on the individual, but the entire family. So, for us, any person who comes to us for help becomes part of the Anatta family and the family which is involved with the person. Because if the person is consuming the alcohol or substances, the rest of the family and friends who are close to that individual also find their lives revolving around that person. And as a consequence, they lose out on their own life, living, and even identity if it's a spouse or a child concerned. Hence, our focus is on the counseling and treatment of not only the person suffering from addiction, but also the entire family. So that's it. Over to
Coming
you, Vandana.
to what you mentioned, yeah, thanks, Sujata. So, coming to
Hmm.
what you mentioned, two questions come to my mind. One is I would like you to elaborate on the single client facility, and then later on
Yes.
we can go on the codependency counseling according to your view, a doctor's view. So, first, would you like to
All
answer
right.
about the single client that we have?
Sure, sure. See, Anat, we are currently, and we have always, in fact, treated every client individually. And currently, we are in our destination therapy, as Vandana had shared in the beginning of our session right now, that we are now in Dehradun, and we are based from Dehradun currently, wherein we are focusing on our single clients. By single client, I would mean those individuals who would like to be treated alone for the sake of their anonymity and their absolute abject confidentiality. So our confident for us in Anatta, the confidentiality, maintaining the confidentiality of the client and maintaining the anonymity of the client is of the highest importance. So those individuals who would like that to be maintained are treated individually in exclusive, luxurious surroundings, very close to nature, with a group of therapists as a team of therapists that go with the client. And we also travel with the client. Prior to the COVID situation, we would be traveling across the world, but
Yes.
unfortunately, because of the COVID, now we have chosen to choose different unique locales all across India. Of course, keeping in mind that it is the safest place where the current corona situation is concerned, that the least number of cases are there, and at the same time providing the similar luxury and ambience that the client is used to. Now, why do we provide this luxurious ambience? Because the client who comes to us, who seeks that individual attention, is already used to that kind of an ambience. So it is for him going from his or her home to another home. That plays a huge role in the client's mind wherein treatment is concerned. So the client finds it easier to relax into the environment, which is definitely new for the individual, with people who are definitely new for the individual. But at the same time, these are individuals who have gone through what he or she is experiencing currently where addiction is concerned, and have lived life beyond addiction successfully after following their own respective treatment processes. So the person identifies and gets inspired by the individuals around him or her. There is a physician available 24/7 in order to take care of the health of that individual. Also, so that one can be aware that, okay, if something is going wrong, if something is being affected, it can be attended to immediately. So, and it is in an environment which is like a home, away from home. There is everything that is followed on a day-to-day basis, which is non-regimented, which is in an absolute freedom-oriented environment, wherein the client, on his or her own volition, is participates 100% in his or her own treatment process. So that is our single client destination treatment that Anata is doing.
And I would also like the viewers to know in the single client facility or the one or two client facility that we all are stationed here in Dehradun, even we as counselors, we are flourishing. The locales are very good for our own growth too. So, Dr. Sujata, now that takes me to 2 points that you made. One is
Yes.
I would like you to share about the non-regimented program. So, and why does Anatta take only voluntary patients? Why do we take only voluntary and not involuntary patients?
All right. Now, I will first begin with why we take only voluntary and not involuntary people, individuals. See, someone who is suffering from addiction is suffering not of his own volition in the first place. So that process of addiction is itself an involuntary process because the person is
Hmm.
not drinking or using the way he or she would like to. So,
Hmm.
and the one he or she desires to stop but does not know how to do it. Now,
Hmm.
because of an unawareness of the family on the part of the family or the individual himself or herself, one finds oneself in an involuntary process wherein it is against one's desire to be there. If it's against one's desire to be there, even if it's a five-star facility and if it's in a lock and key, the individual
Hmm.
shuts down and does not open up to the treatment provided, even if it is the best treatment process, simply because
Hmm.
it is happening
Hmm.
against that individual's will. So, in our experience of the past 15, 16 years that I have experienced treating so many clients over the years, only those who come of their own free will are the ones who show the best results. Simply
Hmm.
because one wants to stop, one does not know how to stop, one has made several attempts to stop, and then one finally finds the place that is required or desired, or wherein you're taken in out of your own free will, and it's a place wherein the ambience is according to what you would like to have. And you have therapists who have been there, done that, and are living a sober, healthy, fulfilling life. So that opens up the mind of the individual and makes that person want to be there, want to be treated, want to seek help. That wanting to seek help, wanting to stop, and the willingness to do whatever it takes to stop, that is what we see in a completely voluntary process. And we take that from there to the rest of that individual's journey. We always say that the first step is that the person comes on his or her own free will. That's half the battle won, right there for us.
Yeah.
And the second portion, Vandana, can you just repeat that? What you
Yeah,
had
I'll
asked.
come back to that. I'll just add to
Hmm.
what you just shared, Dr. Sujata, because the therapy that we provide and the ambience, as you rightly explained to the viewers, what happens is when the family gives me a call, or the spouse, or the father, mother, or friends are giving me a call, and I describe this whole thing what you just shared, and they find it a little
Hmm.
difficult to believe that such a place exists in India. And I
Yes,
tell them, do visit us, look up the place for your loved one, because at the end of it, or to begin with, you're putting your loved one in our hands. And that should be the honesty and the sincerity that we are able to convey when they visit our place, and the ambience that they look. It matches to what we talk. It's not in the opposite
absolutely.
direction, nothing less, nothing more. And that makes them really confident of our program that we start from the day one. So this brings me to
Absolutely.
the question that I asked you is about the family therapy, the codependency counseling. How good it is,
Yes.
explain it to the viewers in your understanding and in medical terms.
Yes. See, what happens when an individual is drinking or using and the family is living with the person? The family is seeing that individual going down the drain, so called, because of the consumption of the substance. The person is getting affected physically, emotionally, mentally, socially, as far as his economically or as far as his job or business is concerned. The person is unable to make the right decisions. The family is seeing all this, the family is not drinking. So when the family sees all this, they wonder, like, why can't this person see it for himself or herself? Why can't this individual stop using or drinking? And in the process, if there is a spouse involved, then she or he try his or her life starts revolving around this individual with the sole focus of getting this person to stop to drink or to reduce the consumption of the substance. But that does not happen because that is the way the disease is, which also brings down the lying, the
Hmm.
manipulativeness, because the lying and the manipulativeness also happens when there are deficiencies of the vitamin B1, B6 and all in the brain. The person starts creating stories, starts lying just because of the influence of the substance, but the family innocently watching all this does not understand and is flabbergasted. So for us, treating the family, making the family aware, one, of the disease, of the nature of the disease, so that they also understand where this person is coming from. Like if the person is suffering from diabetes, that person is not going to be demeaned or looked down upon or or treated any differently from someone who is ill. Likewise, unfortunately, however, where addiction is concerned, simply because of the behavior of the individual after intoxication, it seems so insane and seems so difficult to manage that to accept that this is also a disease is very difficult for the family and for those who are seeing that individual in that state. So our job is to make the family first aware that this is a disease, this individual requires help, and at the same time to bring the focus back on the family, wherein they are not intoxicated. However, they are emotionally, they get so swung from one end to the other end into an emotional roller coaster ride that they require equal help as the person who is drinking or using substances. Hence, family therapy for us, or codependency counseling, which is called codependency, whereas this person is dependent on the substance, and this person is dependent on the individual using the substance. So that is why it is called codependency, and that is why they require equal help. And that's the reason why we
Very well
focus more
explained.
and equally on family therapy too.
Thank you. Thank you, Dr. Sujatha.
Yeah.
Let's come to the stages of treatment at Anatta.
Okay. The stages of treatment at Anata would be like someone who is coming in seeking help would require to go through a period of clinical stay wherein the person goes through a detoxification process. By detoxification, I would mean the person goes through withdrawals because of stopping the substance, some physical and mental discomforts like lack of sleep or lack of appetite or a sense of nausea, vomiting, etc., that can happen. So that is taken care of with the help of certain medications, mild sedatives, IV fluids to replenish the person's body, etc. So the person regains some semblance of strength. All right. In that state, during that state, there is an entire biochemical profile that is done of the individual so that if the substance has created any physical damage, that can be known and that can be treated accordingly. So that is the stage of detoxification. After the detoxification process is over, by the end of which the person sleeps better, eats better, the person is shifted to our facility, which is our luxurious individual care facility, wherever the person chooses himself or herself to be. And in that facility, the person is introduced to a program, what we call our alternate life therapy program. Now, this program is non-regimented. It is based on absolute freedom. Now, no one who lives a regular life will sleep at 10 a.m., 10 p.m. or wake up at 5 a.m. in the morning. So hence, for us, the focus is the person should get enough sleep, enough rest, because rest is healing also. So the individual can sleep when he or she wishes to, and can wake up when he or she wishes to. When in the duration of time that the person is awake, the person needs to follow a certain program. The program involves 2 or 3 meditations in a day. There is watching videos on relevant topics, and there is writing in a very specific manner. There is counseling which happens, which is spread over the day. It is not like if there's a counselor available, that's okay, 10 to 11 you sit with me, or 2 to 3 you sit with me. No, it does not happen like that. We have the advantage and the luxury, we too have the luxury, Vandana, of treating one client at a time. Hence, we can provide the facility completely, the focus is completely on that individual, and the person can take our help whenever and whichever time of the day the individual requires. So the counseling is spread out through the day. There is also a lot of fun element. Like if it was not the COVID times, we would be taking the client out to movies, for meals outside, for shopping, for trips, for treks, mini treks. Why? Because fun is also associated with drinking or with using substances. So that element of association is also broken with us. So it's very important that happens. Now, that is the duration of therapy for the person for the residential stay with us is at least minimum of 8 weeks or 12 weeks. Now, it depends on the kind of substance the individual is using also. If it is a single substance, then 8 weeks we would term to be enough. But if it is multiple substances, if it is illicit drugs like cocaine or crystal meth or MDMA that is involved, the damage that these substances cause to the person's emotional states and mental states, long-term effects are very bad, and that takes time to recover. So, in such individuals wherein there are multiple substances used, our treatment program can extend anywhere between 3 to 6 months too. As we say, it's a very client specific program. So, our program is very tailor made to an individual client. At the same time, there is family therapy that happens parallelly, which you handle, which you being our family therapist, that happens parallelly. And so the family gets an equal advantage of being with the client. Around 4 weeks after the person is staying with us, we invite the family member, if there's a spouse involved, the spouse or the parent, to come and stay with us for 3 to 4 days. So that if there is any issue that requires addressing in the relationship, that can be addressed in the form of a family intervention in the presence of the counselors involved, so that things can be amicably resolved. A follow-up program after the residential stay evolves with each individual client. On a very generalized basis, a follow-up would be after the treatment stay with us, the individual goes back home, stays back home for around 10-15 days, wherein during which period the person can face new and fresh challenges that can be addressed when the person comes back and stays with us for 4 to 5 days. For the first year, we recommend the individual comes back and spends at least 3 to 4 days with us every month. Otherwise, if the person faces any kind of emotional disturbance, we are only a phone call away or a flight away or a vehicle trip away. So we are always available for the person who's suffering and the family members involved. So this, I would say, is our different stages of our treatment process. Putting it very,
So,
very
as
simply.
yeah, nicely said, Dr. Sujatha. So, as you said, how important is the treatment program and the time that they put in with us? Even after they are done, Anatta remains a forever friend and forever family to them. And follow-ups, they coming back after a gap of 45 days to 2 months, coming to us again for 3 to 4 days or a week, depending on the availability of time that they have, is also part of the Anatta program. A follow up, regular follow
Yes.
up is a must.
Yes.
So that brings me, Dr. Sujata, can you elaborate on the detoxification? Why is it important and why is it required when the program begins of the individuals that come to us?
Yes. See, what happens is someone who is using, say, for example, I'll take one substance, say alcohol, which is understandable by most people around. If the person has been consuming alcohol, say a bottle of hard liquor a day for more than 10 years, 20 years, the person is used to that kind of consumption when the person is staying with, is away from us, not yet with us. Now, when the person wishes to come to our residential treatment process, the person has to stop the consumption of that substance. It is not tapered off. It is not given in when the person is coming with us. It is not given to the person in little quantities. No, we do not do that. But it has to be stopped completely. Now, when the substance is stopped
Cold
completely,
turkey.
for example,
Hmm.
cold turkey, as you call it, the person
Hmm.
can go through some physical, emotional, mental disturbances. Now, where alcohol is
Hmm.
concerned, he or she can find it difficult, very difficult to sleep properly, will find the appetite low,
Hmm.
can have tremors in the body. It's like the person, in some people, the entire body shakes. The person is not able to even hold a
Hmm.
glass straight. It's
Right.
like a terrible shaking that happens. There
Hmm.
can be
Hmm.
nausea, there can be indigestion, there can be severe acidity, gastritis that happens as a consequence of the substance consumed. And all these are very disconcerting and discomforting to the individual, and which can prevent the individual from staying the duration that is required. And why should the individual go through so much discomfort? There has been enough discomfort caused by using the substance. So, if we can alleviate this discomfort caused by leaving the substance, then that also motivates the individual to stay a longer time. Now, if we don't provide those mild sedatives or medications that are required to help the person sleep or to help the person eat better, provide the IV fluids to flush out the substance, what happens is that, especially, say, for example, in alcohol, the person, because of the abject lack of sleep and the lack of alcohol in the system, can go into a state called as delirium treatments also, in which the person can go into hallucinatory experiences. A hallucination is when the individual sees things or people which are not there, or hears voices in the ears of people or individuals which are not there. So there are visual hallucinations and there can be auditory hallucinations. At the same time, the person can go into seizures or epileptiform seizures, which we call in layman's term as fits. And this and the blood pressure of the individual can shoot up. Now, this combination can prove to be fatal too. So we do not want any person to reach this stage. Hence, the detoxification process is very important, wherein there are just mild sedatives given, IV fluids given, supplementation given of vitamins and nutrients so that the person can gain physical strength. The sedatives and mild tranquilizers are given so that the individual can sleep and can remain calm, because the mind that is away from the substance is racing, whether it's alcohol, whether it is substances, it races. And that causes a lot of emotional disturbance. So the initial 7 to 10 days of the detox, as long as the detox lasts, helps the person to ease himself or herself into our system, into our process, and helps the person tide over that uncomfortable portion of the treatment process more easily. And mind you, our counseling starts from the person entering even our clinical environment. There is always someone with the person available to talk, to share, to understand what the person is going through at every time, every moment of time. Our team psychiatrist, Dr. Jairajani, our team MD Med, Dr. Menon, are available to the individual anytime the person needs. They are well monitored. Any kind of imbalance is taken care of very well. A psychiatric assessment is done by Dr. Jairajani. A psychological assessment is done by him during the detox period also, and also after the detox when the person comes to us during this day. So this is the entire importance of the detoxification process, Vandana, during which even investigations are done to assess if there is any physical damage caused by the substance use, long-term substance use, so that can be addressed. So all this portion, this phase is extremely important for the person to get back to a semblance of balance physically and mentally, and ease oneself into the treatment process. Thank you.
Well done, Sujata. So I would like the viewers to know ours is a non-medical program. So the medication, very little amount of medication also that we use is eventually tapered off, and they are not left with any kind of dependency from the beginning of the program. It is just monitored very well, and we help the person. We just ease out the process of withdrawals. If we have to put it in layman's term, it's just an easy
Yes.
process so that they don't lose motivation and continue the program till the end, till the time that they need to continue and understand the whole training. Why is it done? The alternate therapy program, I would call it as a beautiful training program to live a life beyond the substance. And I should be able to find joy, as you rightly put it earlier. So the attachment, the joy perception which has been associated with the substance is moved out to living a life on the other side of the fence, which is as beautiful as they can watch the other experiential people that are working in our environment. They are doing that they are leading the life that they wish to experience. So here I would
Yes.
bring your attention, Dr. Sujata, to the fact that apart from the doctor's team that you all are, that we have, that is Mr. Mahesh and I, Vandana, we are experiential counselors other than the whole team that we have.
Yes.
Why is experiential counseling has a great emphasis in our program?
See, where Mahesh comes out of his experience of having been an addict to alcohol for several years of his life, and now he's in recovery for nearly 18 years, and you having been his wife and experienced that codependency state of mind and body with him for all those years, and today when you have grown to the stage where you are, someone who is suffering from addiction for so many years and is looking out of a way out of it and does not know how to, when that individual meets Mahesh and Mahesh shares his story with that individual, what the person is seeing is not someone who is 18 years sober. No, because that does not happen overnight. That person is seeing that this person also had been through the suffering that I am going through for nearly 18 years of his life himself. And he chose to go into a treatment program for himself to get himself treated. And these are the things that he went through when he was also drinking, which is very similar to what I have gone through. The individual who is meeting Mahesh would think that even I have been through, he has been through what I have been through. So there is an identification process right there. And the other identification process when Mahesh shares of of the treatment that he has gone through. And after treatment, the life that he is leading. That is, life brings you bollocks and bricks and bats, but the choice to live life fully and face life's tribulations and trials in every step of the way without having alcohol as an option in the mind, of living a fulfilling life which is 100% present in the moment, and being able to face all the trials without the need to drink. The idea is without the need to drink or use the substance. That is extremely inspirational for someone who is in a struggling stage, trying to enter the treatment process or looking at finding help. And that provides that tipping point wherein the individual decides to come into help, seeking that help required. And even the family, Vandana, when they speak with you, the families are the people who usually connect with us first, and you are the person who handles our helpline number and who is there on the other side of the line for that family member, whether it is a spouse or the parent or the child who's calling up. When that person understands and realizes that you have been through what they are going through, and you have reached where you have reached, wherein you are able to help other people, they also start seeing hope that, okay, if this person can be where she is today, I can also be there, and I can also help my loved one to reach this place which is required for him or her to reach. That is before the person comes to us to enter the treatment process. Now, when the person is with us in our luxurious ambience, in our residential facility, wherein the person has these experiential people around him or her who have been there, done that, and are living a happy life today, the sharing, the counseling processes that happen is based on self-disclosure. Self-disclosure means experiences that I or the person who is living with the client have gone through in their life, where addiction is concerned, where living life away from substance is concerned. That person identifies with that individual. Okay, I am not alone in this process. Addiction is a disease of isolation, wherein the person first starts isolating oneself in order to use, then the society and the family also starts isolating the individual, because that person is unable to be part of a family or part of a social event or society, simply because it is the substance that is ruling over that individual. So when that person sees other people who have been in the same boat as him or her, who have a similar story which resonates within him or her, that person sees hope and is able and understands that if I have to get what he or she has, I have to walk the path that he or she has walked to reach where he or she is. So that walking the path is doing the process, doing the program, doing the work that is required, or whether it is the writing, whether it is the sharing, whether it is the watching, basically introspecting into one's own life, assuming responsibility for one's own life and one's events that have been consequent because of the addiction and to alcohol or substances, and knowing that this individual has been where I was and is today where he or she is, provides a great impetus and inspiration to do what it takes to not find the need to use where the other person is at. So that's what I feel is our
Two thumbs up.
what we give. Thank you.
Dr. Sujatha, I feel the viewers should know uh, how the Anatta crew, the Anatta, the whole staff, manage our own emotional balance, because we meet various kind of people. They are going through their own journey and challenges, and we are here where we support them and try and find out each and every aspect through their sharing, through meditation, through our writing techniques. How do we take care of our emotional balance? Would you like to share
Yes. Now, Vandana, the great advantage of us as people being in the therapeutic team, whether we have a background of substance abuse or me who has a background of having been an extremely emotional individual and having worked on myself, to the same process that we share with our clients. We all have been through our own individual processes of going through our emotional issues first, treating ourselves first, training ourselves first, and then only have each one of us entered into the fray of helping another individual. See, every person comes with their own life story, which can have a lot of ups and downs, a lot of sorrows, a lot of experiences which have been very painful and might not, and we hope that no one else has to go through all those sufferings. So, in such individuals, we are listening to that person because we have dealt with our own emotional issues. We have developed a detachment for our own issues which we have gone through. So we are able to maintain that emotional detachment within ourselves when we are listening to another individual, simply because what is required here by us is not to sympathize with the individual that the person gets has got enough from the family and friends around and does not help him or her. It is not empathy, putting oneself in that person's shoes, because then we are also flowing with the emotion of that individual. However, it is absolute compassion that we are looking at, which is very, very important. Absolute compassion, unconditional, non judgmental acceptance of the individual as he or she is. Because the person who is coming to us, who is in front of us, might have even subjected somebody to a rape, or might have murdered somebody, or might have stolen some things, might have done some uh, irregularity in business or some irregularity in finances. It's part of the disease that happens. But if that person finds that the person or the therapist who is sitting across from him or her does not even flinch when that person is sharing all these things, we are accepting the person as the person is. That helps that individual to be himself or herself. And it helps us because we are detached from that event. It helps us to help that individual even more, because if we also become emotional about that person's story, then we will never be able to help that individual get out of that state of mind that the person is in. That is how we deal with it. We also go through our own meditations. We take care of ourselves by writing. If it's not that we're enlightened, we too go through our emotional ups and downs, but we deal with it in the same manner, through writing, through sharing, through meditations, to help us remain in the present and get beyond our emotional states. These are the tools that we share with our clients. And why are these tools that we share with our clients? Because we have used those tools ourselves in our lives. That helps us maintain our sanity. We do not share anything that we have not dealt with already. Why? Because then the counselee will try to become the counselor. But we share with them things that we have already dealt with. And so that person also understands, okay, this person did this to get beyond this. So probably if I try this, then I can also get beyond my emotional state of where this experience is concerned. So that's how we do it.
So let's sum it up that we are people who walk the talk.
Yes, absolutely.
So now I'm
Absolutely.
going to ask you a question which has come from our viewer. Dr. Shashi Menon has asked this. How do you handle a
Yes.
situation if your client is losing motivation for any reason after the initial voluntary entry? How do we, and if there is a serious medical problem coming up, making the person lose focus? So if they lose motivation or a serious medical problem, how do we act on that? How do we work?
Yes. So, Dr. Menon, if the person starts losing motivation for any reason, it might be that the person is, see, when the person remains away from the substance, then the person suddenly realizes, like, oh, my has been hampered like this, or oh, my family has been affected like this, oh, my parents who are not well are like this. So, suddenly the focus shifts, like, okay, I have to take care of all these things which I was not taking care of when I was drinking or using. And sometimes it can happen that the person loses motivation and the focus shifts from oneself to everything around. That is where our experiential counselors come into play, wherein who they also, when they have entered their treatment processes, whenever they had taken treatment, might have gone through these similar emotional states in the initial stages of their treatment processes. So they share their experience with the individual, and they share how they went beyond those mental games that their minds played with them in the initial stages of their treatment process. And that provides a motivation to that individual to continue to stay in the process. Now, if there is a serious medical issue that happens, then of course we always have a tie-up with a local hospital. We have always have doctors on call who are available to come and shift the individual if the person requires a hospital stay or take care of any medical issue that happens with the individual. And because of the immediate attention provided to the process at hand, to the discomfort at hand, or to the illness at hand, the person starts feeling comfortable soon enough, and the focus is able to be again retrained on oneself, because we are available to the person as and when the person requires. That provides a motive point to continue to stay in the process. I hope I've answered your question, Dr. Menon. Thank you.
Yes, he's telling you very well put, Dr. Sujatha.
Yeah. Yes, thank you.
So I had five features written down while you and I are discussing our own Anatta Rehab Center:
Mhm.
anonymity, privacy, confidentiality, dignity, compassion. Let's
Yes,
let's give examples and suggest what do we mean by that.
sure. Um, Anonymity and confidentiality, I'll bring that up first. The individuals who are coming to us, say for our single client program, they are people who are already beset and besotted by people around them who are constantly at their beck and call, or who have their focus on them, and who, in front of whom they have to maintain an image. If it's a public figure, then they have to maintain a public image. If they are a media figure, they also have to maintain a public image. So when this ailment of addiction is such, which is so stigmatized in society, unfortunately, not only in India, but even across the world, the stigma remains. The person finds it very difficult to seek help. The person tries to hide the ailment for the very longest time from people around him or her, which unfortunately the person is unable to do so. The disease of addiction is called, and it's like an open secret, unfortunately, whereas however much you try to hide it, the more it explodes in one's face. And especially for such an individual who is at that stature in the front of the media, or who has an image to maintain in front of people, they find it unable to be themselves. So when they come to us for treatment, we maintain that anonymity and confidentiality to the maximum, so that it benefits that individual to be able to let off that guard, that 24/7 image that that person needs to maintain, and is able to be himself or herself in order to accept and receive the help that is provided to them.
Hmm.
That is where the voluntary, that is where the anonymity and the confidentiality is concerned, where the compassionate acceptance of the individual is concerned. I spoke even a little bit earlier that that person who is suffering from addiction loses the compassion, love, and acceptance of even their own loved ones. Not There
Hmm.
is no blame over here, but that suffering of that individual that the person is going through, when the family sees that, is also shared by the family in an indirect manner. So they are also suffering likewise. So then it is very difficult to experience love and compassion for the person who is suffering by the family. Society, though, is a different game altogether. They are there to pass comments, to laugh, to point fingers very easily. No one steps up and says, okay, this is a place that you need to go to. This is, you need to seek help.
Hmm.
You need help. This
Yeah.
is the place that I have found that you can go to. No one says that. Even amongst relatives, even amongst friends, so-called friends, using friends, there are people enough to pull the person down. So the person does not is deprived of love, compassion, acceptance from those around him or her. So when he or she comes into treatment with us, into a treatment program, the therapeutic team provides that absolute non-conditional, non-judgmental process and complete acceptance of the person as he or she is. That helps the person, as a consequence, to accept himself or herself also, because that individual is also extremely judgmental and self-critical of himself or herself. So that person learns to start accepting himself or herself, start loving oneself, and hence becomes more receptive to the therapeutic processes that the person needs to participate in. And of course, our entire process is voluntary. So if the person comes of his or her own volition, then the person will will receive the maximum benefit from it. Dignity of the individual, of the person arriving with us, is maintained at the highest, because that person has lost his or her own dignity in his or her own eyes also, let alone of people around him. So redeveloping that sense of dignity happens when the people around also treat the person in a dignified manner. So then the person learns that, okay, I too deserve this, I can be like this, I can be respected, I can respect myself, because that individual has lost all sense of self respect too, all sense of self esteem too. That starts growing and developing during the treatment process as a consequence. I hope I've answered your question, Manu.
Hmm. Yes, you have. So I have one question here. Is Sujata, we also deal with sexuality where the
Yes.
emotions are concerned. I think we are one of, maybe we are the only rehab that, along with dealing with fear, anger, their compassion going to a low level, dignity going down, the they become like an outcast in the society, and we are here
Yes.
ready to accept them with open arms and help them go through the treatment program. So one thing you and I have noticed over the period of our own career in this profession is sexuality, their struggle with sexuality. Can you give the viewers the relation between addiction and sexuality?
Yes. Sexuality or is not just having sex or the act of sex. It is what happens between our ears in our head, as what we put it,
Hmm.
putting it very simply. Now, where addiction is concerned, where substance use is concerned, whether it is alcohol, whether it is drugs, the desire to have sex, all senses get very acute and very aroused. So the desire to have sex is increased. However, the ability to perform gets affected. But by what do I mean by
Hmm.
that? The ability to reach an orgasm takes a longer period of time. The ability to get an erection where a male is concerned or reach a state of arousal where a female is concerned takes time, simply because of the substance used, whether it is alcohol, whether it is a downer like alcohol, or whether it is an upper like cocaine or crystal meth. The desire is enormous, but the ability to perform is less. But it appears like the sexual intercourse is extended for a long period of time. So it can extend to half an hour. So the person perceives that extended sexual intercourse as enjoyment, as fun, and that is what sex is all about. And that association of the substance, using the substance, and having sex also somewhere messes up with the reality of how much an intercourse can actually last. And then, when the person has
Hmm.
stopped using substances, has come into a treatment program, and is living a life away from substance, one finds that the ability to retain an erection or an arousal lasts only for a shorter duration of time. It does not last for an hour, hour and a half, etc. So, that inability to last that long can affect the person's emotional state, and the person, to the extent that the person can feel, am I becoming impotent? Am I being someone who is unable to satisfy my partner? Then that itself can result in a lot of distress emotionally. There can be actual sexual and organ, so genital organ related damage caused by the substance also. Like, for example, alcohol and other substances can result in erectile dysfunction in men. It can result in infertility in women and menstrual irregularities in women. However, just because of the lack of knowledge, the person gets so affected emotionally and disturbed by the fact that if it is not addressed, what I have seen is that 95% of relapses is a cause. Is I'm giving a ballpark figure. It is not an exact statistical figure over here, but maximum relapses happen because of a sexual connotation. Hence, it is extremely important to address this sexuality issues that the person has gone through or is going through in one's life very openly and very incisively, very objectively in the treatment process, which will help the person tide over it. A lot of our clients have gone through sexual abuse or have gone through trauma in their childhood, which can lead them into using substances in the future, and if that which has been unaddressed. The sexual abuse, sexual trauma has been unaddressed. And because of that trauma, the person goes on to make decisions and choose partners in life which resonates with that trauma instead of which has been unaddressed. So if we are the people, when they come to us, we address every issue that happens, every sexuality issue, every issue related to sex and sexuality. That helps the person to truly get beyond these issues and understand things medically, practically, realistically, even where sexuality is concerned, and learns to have the patience with oneself. And the family also learns to have patience, the spouse learns to have patience with one's partner, and the relating and the relationship with oneself and one's partner can be improved consequently. If there are any medical issues, that can be addressed and looked into. So that relieves the person of that emotional stress related to addiction and related to sexuality. And our experiential counselors are the best people to address those issues with our clients.
Yeah, Sujata. So that's what I've seen. Once the ice is broken and we have an easy communication, our clients find it very easy to share and open up them their, the closet full of demons, skeletons is open, and each and every
Yes.
issue is dealt with sensitively.
Yes.
Again, with a lot of dignity and compassion, and we hope them to reach a place where sex or sexuality should not be the reason or trigger enough for them
Hmm.
to slip or relapse.
Yes. Correct. Absolutely. Absolutely.
So, uh, the other question that comes to my mind, Sujata, is again, you and I have seen that certain people, whether they are on drugs or alcohol, are fine in 8 weeks. Others need 8 months plus. And certain people who go out of the center tend to slip and relapse more. What is your explanation?
Excuse me. So, Vandana, um, one also sees that slips and relapses are part of the disease of addiction, which it can happen. Now, having said that, having said that also, however, the what happens is when there is getting back to, let me focus on the first part of the question, that is wherein you said some people require a longer duration of stay. It's not just 8 weeks, it can be 3 months, it can be 6 months. Now, as I had said earlier, it depends on the substances that the person is using. Like, for example, a substance like cocaine, which everyone who's watching us also would be familiar with, even if they are not in the field. Cocaine is an upper, it's the current party drug. It it makes the person feel absolutely confident, energetic, high on life, and able to focus and look at life and events and activities with a very hyper focused mind. But the downside of cocaine is that that high lasts only for 15 minutes, and to get that high the person has to consume more alcohol, has to consume alcohol to balance the high, or has to take a sleeping medication to balance that high. Or why? Because the emotional dip that the person goes into after that is extremely bad. So what is happening? The person not only gets addicted to cocaine but is also addicted to an additional substance like alcohol. Now cocaine itself creates even structural changes in the brain, which takes even more than 2 years of the person staying away from cocaine for that to recover. Now, what do these structural changes do? They make the person very emotionally labile. They can go through severe emotional swings, which the person himself or herself also is surprised that why am I going through all this? This
Hmm.
can be mimicked or this can be camouflaged by the other substance the person is using, like alcohol, because alcohol is used to calm that mind which is racing because of the cocaine. So when someone has been using cocaine for so long, I'm just giving cocaine as an example, can be any substance, has been using these multiple substances for so long. Like usually it is never one substance when it is an illicit drug. It's cocaine and alcohol, cocaine and Restil, cocaine and weed, cocaine um, and other substances. It can be crystal meth with alcohol, it can be MDMA with alcohol, it can be MDMA with weed. So all these combinations, each substance has its own effect on the brain emotionally, mentally, progressively as an adult, like marijuana, which is used by a lot of youngsters, considering it to be a herb and considering it to be natural, also causes a lot of changes in the brain. It affects the THC in marijuana, affects your cognitive abilities, affects your abilities to retain stuff, affects your memory, and all these things And it leads to something called as amotivational syndrome, wherein the person becomes apathetic to individuals and events in one's life. One loses interest in studying and working, anything in life. One loses interest in doing anything productive in life with marijuana. This is caused by the THC in marijuana. So likewise, in getting this such an individual back to life, practically after such a long period of using, to get that individual to a balance of emotional state, to make that individual learn to desire to do something productive in one's life, takes time. It
Hmm.
takes at least 7 to 10 days for any substance to leave the circulation. Some remain even longer, depending on the substance. It takes 6 to 8 weeks for any substance to leave the tissues. It takes that much time for the individual to realize, for the fog of the effects of the substance to go away from the brain, to realize what is happening around him or her, to be participative in the treatment therapeutic process that is happening around him or her. It takes that much, 6 to 8 weeks, at least 8 weeks. But someone who is using multiple substances for such a long period of time, it can take longer, much longer. So it is, as we are a very
Hmm.
client specific individualized program, depending on the individual coming to us, the duration of the use, the kind of substance abuse, the quantum of use, what that substance has done to that individual mentally and physically, on that basis we decide the treatment, the therapeutic duration of the treatment process. That is one part. The other part, if you would like to remind me,
Other
Vandana.
part, yeah. Other parts, Sujata, some individuals are relapse prone, whereas others are not. So why does this happen?
Yes. I wouldn't say some individuals are relapse prone and others are not, Vandana. As I said in the beginning, that slips and relapses are seen to have been a part of the disease of addiction. Having said that, as I said, it always has an emotional connotation. Every slip or relapse, what we have seen, has an emotional connotation, not necessarily a medical connotation. A physical unmanageability or difficulty sometimes can uh, make the person want to drink or use, because that is seen as a relief process for that physical problem. That can be pain, it can be physical pain, it can be some kind of earlier trauma which the person found relief with using. But once the person has gone through our treatment process, it is usually an emotional trigger, and that emotional trigger need not happen just before the person has picked up that glass or the joint or that substance. It is a process which can happen over a period of days or weeks, wherein there is some situation that is happening in that person's life which has affected that individual emotionally, and that individual is unable to deal with it, is unable to process it, and is does chooses not to seek the help that is available. That is when that person feels that alcohol or the substance is the only option or solution that can relieve me from that distress at that moment of time. Any person with an addictive personality, which the person is usually born with, if the person has gone into substance use, finds the substance as an instant solution to relieve emotional distress, which the person does not want to go through. One wants to escape from. So it's an escape, one. That is why a slip happens. A slip is just using the substance once, twice, or a few times, but at the same time realizing what one is doing and realizing that one needs to seek help. And if the person does not seek help and goes back to a full on usage of the substance as the person was using previously, that is a relapse. Now, in that process, if the person picks up the phone or the family approaches us, which usually the families do, approach us to seek
Hmm.
help, and the help is provided for and accepted by that individual, then that can be halted and arrested over there. And we would invite that
Hmm.
person for a relapse prevention program. So, a slip or a relapse is usually because of an emotional connotation, which can be something which has been building up in that individual, and then the tipping point happens wherein the individual takes up the substance to use. But if the person can identify, so our therapeutic process is to build up that person's awareness to a level wherein that individual can identify that, yes, I am going through this emotional distress. I don't need to handle it myself. I have people who can help me, and I just need to pick up the phone. They're only a phone call away, or a flight away, or a train away, or a mail away. I can do that. That is when they reach that state of awareness and they seek help, then a slip or a relapse can be prevented also. But otherwise,
Brilliant,
as I said,
brilliantly
it
explained.
is. Thank you.
Mr. Suresh Nair, just about our Anatta techniques that we emphasize very heavily on their regular program. So he's asking you, can you explain how the writing process helps incidents and emotions in the Anatta treatment program?
Sure. In our life, we go through a lot of experiences which have probably affected us negatively emotionally. Now, if that incident could have happened, say, 5 years ago, 10 days ago, 10 years ago. But when that incident replays in our mind today also, if we are experiencing emotions very similar to what we experienced when the incident happened, then it means that we have not dealt with that experience of our life, even though our mind fools us into thinking that yes, we have dealt with a lot of things in our life. But if we experience these emotions, recalling that incident, that means we have not dealt with it. That is one part. Now, along something happens in our life, we have emotions that we experience immediately when that incident is going on. Then, after the incident, in retrospect, we have our own thoughts and assumptions and judgments about what happened. There are more emotions that get added on to those thoughts, like the ifs, the shoulds, the coulds, and the buts. I should have not said this. That person should have not said this. How could this have happened? How could he or she behave in this manner? So, there are more emotions of anger, sorrow, hurt that get added to that thought process. Now, over the years, we carrying this emotional baggage because we cannot do anything to change what has happened. Not one moment of what has happened can change. Now, you add a substance to it, like alcohol or any illicit substance. Any substance has the property to enhance whatever emotional state we are in. So something that happened very realistically, if we look at it, should not have such an impact on us. When we add alcohol or any substance to it, it appears to be so magnified that we believe that the individual believes in that magnified version of what happened. And there are emotions attached to that magnified version also. That is what we call as the identification to the person that a person becomes after consumption of the substance. Now, even when the person is not using, that identification remains because nothing has been done to break that identification. Now, when such an individual comes to Anatta and we introduce our writing technique to that person, our writing technique is actually very, very simple. We are writing incidents that have happened in our lives which have hurt us or which have affected us negatively emotionally. The person, we tell our client to write that. Write the incident as it happened. What is an incident? It is a conversation happening between two people or three people or a group of people, or something that we have or the person has been witness to which has affected that individual negatively emotionally. So you're only writing the incident as it happened. Now, what the person felt when that happened, you're just labeling it separately. So incident, label emotions, whatever the emotions might be: hurt, anger, sorrow, disappointment, betrayal, feeling of betrayal, all these are just labeled. Now, as the person keeps writing in this manner, what are we doing? Very importantly, you will notice that the incident does not contain any thoughts. And the emotions are not involving any thoughts or feelings. There are no sentences involved. There is no interpretation of what happened. There is no perception or assumption regarding what happened. It is just what happened and the emotions related to it. When the client continues to write in this manner, these emotions which the individual was carrying forward throughout his or her life starts getting detached from the event that occurred. At the same time, the magnification that the substance created because of to these emotions and to these incidents, that magnification also gets broken. The person starts seeing life up till now, what happened in his or her life, very realistically. And these are the events that happened in my life. These are the emotions that I felt when that happened. And as I keep writing and as I keep sharing and as I keep meditating, I feel that these emotions are getting detached and they're dropping away, and I'm able to let go of them, or let us put it simply, the let go happens. And the person starts feeling free from emotional issues of the past, which were otherwise playing like a record in that individual's head and would translate into the person's day to day life and living in the family, in the society, because of the substance use. So the person starts learning to deal with situations that life can throw at any individual, negative or positive, in a very realistic manner. That is what the writing does. But it is not only the writing, it is the entire package of sharing that writing with someone, with a third person, and hearing oneself sharing also. When one hears oneself share, a lot of things fall in place in one's own heads. That and every meditative technique that we do is psychotherapeutic, which helps in relieving all suppressed and repressed emotions that have been stored by the body. And this entire package together helps the person deal with life realistically and helps the person to free oneself of the emotional baggage that one has put oneself through and assume responsibility of one's life in its entirety, realizing that everything that has happened in my life till today, whatever has happened, whatever I have put myself through, I have put myself through. I am responsible for the position I have reached in my life wherever I am. And the same thing is also followed by the family too, by the way. The same therapeutic process is not just followed by the client who's with us, but also with the family. So they too grow along with the individual who is with us. I
Yeah,
hope that
it
answers
is
my question, Suresh.
extremely. Yeah, and how important the therapy of writing and meditation is for our people who are doing the long-term program with us, as against the family, which gets enough time, but not as much as the dependent. They get little time, but if they wish, they can get much more. But the point is that the
Yes.
therapy, the writing techniques, the meditation are equally important and should have that much space in their life too, so that when the person comes back to them, the is reunited with the family, they should have some connection or communication to begin with on these topics too. So that gets me to a
Yes.
question from our viewer, Karan Mehta. Can you please explain or give guidance on how a person is able to live a sober or fulfilling life while going back to society?
Yes. So, as we said earlier, Vandana, that in our treatment process, if we don't have fun in treatment, then we cannot have fun in living life outside of the therapeutic facility.
Living
Now, what do
soberly.
you learn?
Hmm.
Yes. What do you learn during the therapeutic program? You're learning to live the life. The individual, our client, is learning to live a life which he or she always wanted to live. But the substance, whether it is the bottle of alcohol or whether it is the drug of one's choice, always came in the way, preventing that individual from leading that life that one wanted to live. In the initial phases of using or drinking or using, one feels that that is the solution to one's emotional issues. One gets relieved of the emotional pain, or one numbs the emotional pain by the substance use. But the issues don't get resolved. The issues are right there, whether they're physical issues, whether they're emotional issues, familial issues, social, financial, economical, work wise issues, the issues are not going anywhere. So when the person comes into treatment, when the substance and the haze of the substance lifts from the brain, then the person starts seeing, oh, I have these issues in my life which I need to deal with. Now, during the therapeutic process, through the writing, through the sharing, through the meditative processes, even the fun that one has, like whether it's playing pool, watching a movie, going out for a simple meal, or even for a drive, one realizes one need not have a substance to use. One does not need a substance to deal with life's issues, to deal with one's emotional states, to deal with fun, to deal with work, with family, etc. Because all these areas of one's life, the issues in all these areas are addressed in the therapeutic process of the program. And the client is given the tools required to lead a fulfilling and sober life outside. By sobriety and fulfilling life outside of the treatment process is the life which is in between our 2 years here. This is most important. What is our state of mind at any given in any given circumstance? If there is a trauma happening in our life, once we go out of treatment, if the client faces some trauma, faces a job loss, an economic loss, or a work loss, or someone in the family passes away suddenly, that is also an emotional trauma. But in the treatment program, one has learned to deal with one's emotions, one has learned to deal with one's events in one's life realistically, practically, looking at life realistically, without the pink haze of emotions, without wearing those pink glasses of emotions, without it being colored by emotions. One learns to face one's life, our past issues, and face current issues. So, the tools that we provide to the client of writing, of meditating, of sharing, of us being available to them if there is an emotional distress, are the tools that the client carries forth after the therapeutic process also. during the treatment process, the client learns to have fun. The client re-experiences joy and self-esteem and a growth of oneself, growth of one's confidence during the therapeutic process. So the client has to carry forward this to life ahead. And all these tools are there with the individual. So one is not left without any tools. We do not promote dependency on us after the client goes back, but at the same time, we are available to the client whenever he or she requires us. So that is how the person can live a sober, fulfilling life, by not keeping the substance as an option also in the mind, but using the tools to live life on a day-to-day level. That is how I would put it. I hope I answered your question, Karan.
Yes, you have. So I would like to conclude this answer of yours that you and I, including Mr. Mahesh and the other colleagues that we've traveled with them around the world. We've
Yes.
traveled, gone with them for weddings, or even Kavi Sammelan, or even a
Yes.
simple gathering of family, where they don't want to be
Yes.
challenged by the substance which is available there very freely. In the culture that we are in, having alcohol, a couple of drinks is fine. So for the social drinkers, it works very well. But people who have issues with alcohol are not able to handle themselves in environments like this.
Yes.
And there we come in to give them the support. We are at their back. Not that we need to be introduced to the family or get personal with other
Yes.
people, but our main
Yes.
focus is our client, and to hold on to his sobriety, support him, and take him further. And what you call, just jump this obstacle, just get off this obstacle together, so that he feels the
Correct.
confidence going back to society. You and I have
Yes.
gone to many families with the client when he's finished the program. We have gone to literally deposit the new person to the family
Yes.
and live with them
Yes.
in the first 4 or 5
Yes.
days, along with the client and the family, and
Yes.
ease out the process of getting back to each other, building up the platform,
Yes.
a bridge which smoothens it to begin with, and then they have to take it forward for from us, because
Correct.
as you said, we don't want to be the new crutch. We don't want them to be dependent on us. But yes, the initial
Yes.
phase where we smoothen it for them, that is
Yes.
required.
We have even
And
traveled.
most
We
of
have
the
even
people,
traveled with our clients on international travels. Where in the first international travel where alcohol is available, they
yes,
feel a hitch. So many times we have traveled with our clients
on
on
the
their first
flight,
international travels
yes,
also,
on the
on the
flight we
flight with
support
them.
them.
Yes. Yes.
So just
Hotel
easing
stays,
out the process of
etc.
getting back to society is what is as good as the program. So each and every part that we discuss,
Yes.
Sujata, nothing stands without each other. It all together
No.
compiles and becomes the Anatta program. And
Yes.
we are so good at customizing it for each and every individual that comes to us.
Exactly. That is why it is an individualized program. That is why it is a client-specific program, because each person's challenges are different. Though the storyline might be the same, but individual challenges can be different. So we
Yes.
help them tide over that, bridge the gap with families, bridge the gap with society, help them. We are there to handhold them for a certain period of time.
Hmm.
So yes.
Sujata, can we define triggers for the audience? What are triggers?
See, as I said, that triggers are always something related to one's own emotions, which one has not dealt with. Let's put it like that. Even in the past, if you see, when the person was using or drinking, the person always needed an excuse to use and drink. Now, at that time, it would have been, if the person was married, then my wife did not speak to me nicely, or today she spoke to me nicely, or my parents did not look at me properly. This person looked at me in this manner. There is a important meeting today for which I need to. If I don't drink, then I will not be stable. There is a public performance that I have to be present at, but if I don't drink or use, then I cannot be in my regular state of mind. So even to be in a normal regular state of mind, one needed to use a substance. So all these things were triggers in that individual's mind in order to use, or they were excuses in that individual's mind in order to use. They became excuses,
Hmm.
let's put it like that. Because if those excuses were not there, then the person should not be drinking and using, and then but the person does not know how not to drink, how to stop, how, because by that time it is the substance that is controlling the person. Now, if the person goes back after treatment and if certain issues have not been resolved by the person, then those very issues can become triggers. It can be some long-standing relationship issue. It can be with a parent, it can be with a spouse, it can be with a work environment wherein one has not received a satisfactory work environment. Then, if those issues have not been resolved individually, that can affect the person emotionally. And our clients are people who are extremely sensitive individuals who find it difficult to express themselves also. Core issues they will not express. So those things are kept inside and they start building up. And when they start building up and are left unaddressed, they act as triggers to use. Now, mind you, I am saying internal emotional triggers. It has nothing to do because in reality, nothing outside of oneself can make one drink. Something happening outside of oneself triggers an emotional response from oneself. Where are these emotions? Inside us. But what are we creating as causes for those emotional triggers? Something that is happening outside, which is not true. Which is not true. If the emotions are inside us and we're looking for solutions outside, whether it is in a bottle, a joint, or a person, how can we find it? We cannot. So we have to resolve what is happening inside us. So that trigger which the person uses as an excuse to drink or use is actually inside. So that our job as therapists is to just show that person where the responsibility lies, where of that individual when that person picks up that glass or picks up that joint. At the same time, without blaming the individual, without being judgmental of the individual, accepting that this is part of the disease, and at the same time, just shifting focus again on that individual. Okay, this is what happened. This is what you need to do. Get back on track with your own self. Get your focus back on yourself. As Dr. Jairajani always says, where should the focus be? On oneself. As in treatment, as outside of treatment. So, putting it very simply, a trigger is always of an emotional nature.
So we do show them the mirror, but we care front. We don't confront, we care front. We symbolize the thing to them that this is what needs to be corrected. And these triggers also should be resolved either by sharing, relating, writing, all the techniques that are provided by us in our setup.
Yes.
Almost answered all questions, Dr. Sujatha. Now we come to you. Your own journey of success and challenges in Anatta. Let the audience know that, and then we'll conclude the program with that.
Sure. I have been in the field for nearly 15 years now. And when I entered this field of treatment of addiction, Vandana, I felt as though I am being part of a social cause. I'm doing something great by being by helping in treating these individuals who are social discards or who are in the state they are when they are using or drinking. Thankfully, I did not come from a judgment. I was always somebody who could accept somebody the way the person is, without judging what the person has gone through. However, when I started being participative in this process, I realized that the individuals who are affected with the disease of addiction are probably the best individuals in society as people. They're very kind, they're very generous, they are very sensitive, and they're very intelligent individuals. They're if they set their mind and passion into one thing, they can excel at any field that they put their mind to. The only flaw which pulls them back is their emotional sensitivity, which is misdirected. Let's put it like that. The focus is on everything around except on oneself. So misdirected emotional sensitivity leads them into substance use sometimes, and that substance use leads them onto a path of self-destruction. So that was my experience. And then I realized at that time, when I joined the field, I was also someone who was extremely emotional, though I used to think I'm not an emotional person. But being in this process, seeing people around me made me realize that I am blindsiding myself and I am fooling myself into thinking that I have dealt with my emotions. So I also put myself through, I did the writing process, went through my own counseling, I did the meditative techniques. I realized that whatever has happened in my life, I am putting myself through because I used to face blocks and situations with clients, issues which I have not dealt with. What would I tell a client? And especially counseling is not about giving advice at all. It is showing the mirror to the client. and sharing our own experiences
Sharing.
which we have dealt with.
Hmm.
Sharing
Hmm.
our own experience which we have dealt with being the moot point. Now, if I have not dealt with my
Hmm.
issues, what am I going to share with the client? So I decided to work on myself, and I did that. And then only did I enter into the counseling process. So I was a physician, I was being there as a physician. I entered the counseling process only after that. So till I walked the talk, I did not talk, to put it simply. And the journey has been great with every client. Every client teaches me a lot of things about life, about myself. And I would say every client helps me to grow a little more within myself too. And it's a very humbling experience for me when someone expresses gratitude for one's sobriety towards me, for having been of some use, of some part, playing some part in that person's life and sobriety. I feel it's a very humbling experience. Why? Because it is actually 100% that individual's effort in continuing to remain sober, to reach that person's that place of sobriety. You have to have resolved all those emotional issues in one's life during treatment, choosing to do that for oneself, and then continuing to lead a life of sobriety. It is 100% that individual who has done it. I have only shared the path that I walked that helped me. Let's put it very simply. And as a physician, I have helped that person to deal with his or her health issues. That's all that I have done. So it's a very humbling experience for me too. And God has been kind, and I'm very grateful of where I am today, and that I'm able to be of or to play that role of at least a mirror to an individual at any given moment of time, and to myself also. It began here first, then it went there. Let's put it very simply. That's it. Thank you.
And God has been kind, Sujata, that you are with us in our team, and we are spearheading together to redefine the rehab industry, where, along with all
Yes.
the therapies, dignity and compassion comes first. Will is a very
Yes.
important
Yes.
thing that the person needs to begin with the individual and the
Yes.
families. So, thank you,
Yes.
viewers. Thank you, Dr. Sujata, for presenting the whole Anatta module, the treatment program, the detoxification, the description of each and every element that we use in our Anatta Luxury. Thank you so much. And I hope viewers love your program, our program, and let's move ahead and ahead and help as many people as we can. Thank you. Bye bye.
Yes. Thank you. Thank you, Vandana. Thank you. Bye.